Hello everyone, I hope you guys are doing well. I'm doing good and I'm back with another video. So in today's video, I will be talking about eating disorders and the effects that they have on the oral cavity. Right. So I am well aware that this is a sensitive topic, so I'm not going to be talking about anything deep because I don't want to offend anyone. I'm just going to be giving very generalized information about it. Yeah, and also another thing, guys, please remember I only give generalized information. So if you have any questions, you can visit your oral hygienist or your dentist to clarify, or you can ask me, but understand that I am not your oral hygienist or your dentist, so I won't necessarily know what the full background of the condition is. So yeah, and if you have any like general questions, please just feel free to comment below this video or send me a DM if you feel like it's a bit personal or sensitive. So yeah, let's get into it. So eating disorders are basically psychological conditions characterized by disturbed or disordered eating. So examples of this are bulimia, which is binge eating, then throwing it up, so it's like a binge eating throw up cycle. Anorexia nervosa, where you just avoid food altogether, in simple terms. Overeating, self-explanatory. Binge eating, also self-explanatory, and so on. So yeah, so eating disorders will definitely, obviously, result in poor nutrition, and deficiencies in vitamins or minerals such as calcium could result in tooth decay, because calcium assists in strengthening your teeth and your bones, as we all know since primary school. In deficiency in iron, which can result in mouth ulcers. Deficiencies in your B vitamins, and this could contribute to bad breath as well as mouth sores as well. In terms of the calcium, you also require vitamin D in order to absorb the calcium into your body. So you may be taking in enough calcium but not enough vitamin D, and therefore your body cannot absorb it. So those two go hand in hand. There's quite a lot of chemistry involved, and I'm not gonna like dive deep into it. I'm just like I said, just generalized information. Okay, so yeah, poor nutrition can also result in swollen and red gums, and you are then susceptible to or more prone to getting gum disease, because then obviously your immune system is not strong enough, and any germs or bacteria that are sitting on your teeth and on your gums are most likely to thrive, because your body's immune system is not as strong as it could be or as it should be would be in a normal case or like normal circumstances. So yeah, people who often suffer from eating disorders also suffer from dehydration as well, and this could cause a condition called xerostomia, which is basically dry mouth. This also makes the patient more prone to getting gum disease, because your saliva has antibodies, which are your soldiers that fight off disease from the body. So yeah, and the person could also have like red and dry and cracked lips. So yeah, so for that, me as an oral healthcare professional, I would then recommend that the patient gets, obviously you drink more water, but in that condition where the tongue is like smooth and red and inflamed and it has cracks and fissures in it, then swishing like ice around could also help with like the burning sensation in the mouth. And you also get gels that one could use on their gums like all over the mouth, basically, like your gums, your cheeks, your tongue, just to help with the xerostomia, just until you get better. So yeah, so chronic vomiting can result in chemical wearing of the enamel. And as we all know, the enamel is the outermost part of the tooth, the part that protects the tooth, the hardest part of the tooth. Something that's chronic is something that is continuous and ongoing for a long time. So that could result in the wearing off of the enamel, and that obviously results in a more weaker enamel and a more brittle enamel. So the enamel is prone to chip, break, and expose the most sensitive parts of the tooth, which is the dentine as well as the pulp. And the pulp of the tooth is basically the tooth's life, because that's where the blood vessels are found, as well as most of basically the nerves of the tooth are found there as well. So if the teeth break and they start chipping, you're prone to sensitivity, because the more softer and more sensitive parts of the tooth have been exposed. And obviously the shape and the color of the tooth will change as well, and that could obviously cause the person to experience emotional distress, because imagine you're going through this condition and it's changing the way you look. Obviously you're not going to want to smile anymore because your teeth are starting to look bad. And yeah, so guys, side note, I know this got very little to do, but also a lot to do with what I'm talking about. Just be kind to people. Like, you never know what someone is going through, and you might think it's funny to laugh at the fact that their teeth look a certain way, and you won't necessarily know why they look that way. So just be kind and just be aware of the things that you say to people and how you treat people. So yeah, because also that just says a lot about you as a person. Okay, back here. In extreme cases of chronic vomiting, this could result to an infected pulp and even death of the pulp. Like I said, the pulp is the life of the tooth. So if the pulp is dead, that means that the whole tooth is dead. There's no more life to it, and it will obviously change color. I don't know if you've seen this, but like, it also happens in trauma cases where you like bump your face against something, and then like you bump your tooth, and that tooth that you bumped starts changing color to like a more grayish, it has like a grayish tinge to it, like almost translucent, but not really. It's just like gray and dark. That's an indication that the pulp is dead. Eating disorders could also result in degenerative arthritis, and basically this can be caused by the fact that you are lacking essential vitamins and minerals. Like you have poor nutrition because you're not eating, or whatever you are eating, you're not giving your body enough time to absorb it. So yeah, or you're just not eating the right kinds of food, and basically this could affect your TMJ. So the TMJ is your temporomandibular joint. It's the joint here that joins the skull and the jaw bone. Yeah, so it's that joint, like if you open and close, you can feel it. And this could result in like chronic headaches, difficulty in chewing, difficulty in opening and closing your mouth. And with that, what you can do if you are struggling with your temporomandibular joint is to obviously seek professional advice, but also like things you can do at home is like use a warm face cloth, just dip it in like warm water, press it against the side of your face, and then just like keep exercising that joint, so it keep opening and closing and opening and closing, and that should like provide you some sort of relief in that area. Your healthcare practitioner, whether it's your doctor, your dentist, will be able to advise you accordingly to your case or to your condition. Another thing that chronic vomiting causes is basically cuts and redness on your soft palate. So that's like right at the top of your mouth, but right there at the back, almost down your throat. So right there. Obviously you can't see what I'm doing, but like I'm sure you get what I'm trying to do, and I don't have my model here to show you guys. So yeah, and obviously that's a telltale sign that someone is constantly purging, because that's rare to find in like a normal case. So yeah, it's just one of the signs for us as healthcare professionals to notice. Frequent binge eating and purging, so bulimia, can also result in enlarged salivary glands. So your salivary glands are like here, like on the inside of your cheeks, as well as under your tongue. You could end up looking very swollen, to say, yeah, like in your cheeks and your lower chin, and that could also cause emotional distress. Now your outside appearance is changing, and not for the good. If someone is suffering from an eating disorder, they obviously need a lot of support. They obviously need psychological treatment, as well as it's basically integrated treatment like this. They will require psychological treatment, obviously treatment from their GP, as well as treatment from their oral health care professional, like their oral hygienist or their dentist, or their oral hygienist and their dentist together. So it's not just one person's job. And with the support, like I said, I haven't said this, but a lot of the signs of eating disorders are present in the mouth, and as a healthcare worker, it's up to me to make my patient feel comfortable to be able to talk to me and let me know if they are going through anything. And if I suspect something, I mean, on grounds, I am allowed to like report it or tell their mom, especially if they're minor, and then they can just take it further, go see a doctor, and then eventually see a psychologist or even a psychiatrist if it's like a really intense case. But like I said, it's a very sensitive issue, and I don't want to like dive deep into it. That's why I was just giving like very generalized information. Also another very, very key point is, after vomiting, a lot of people want to brush their teeth like very vigorously because they think that's going to help. It actually doesn't help. So the best thing to do is to just rinse with just plain water, and then like an hour later, not less than an hour, about an hour later, you can then brush your teeth. Okay guys, that's it for today's video. I hope I wasn't rambling too much, and I hope I was making sense. If you guys do have any questions for me, please feel free to comment below this video, or you can DM me if you feel like it's a bit sensitive and you don't want to like show the whole world. That's okay as well. But yeah, if you are seeking real answers or like very specific answers, then please just visit your oral hygienist or your dentist, and they will be able to help you accordingly. Another thing guys, don't be afraid to seek help. Everything that you tell your healthcare professional or practitioner, they are not allowed to disclose, and if they do disclose it without your consent, then you can take it up with them. So just remember that you as the patient, you have rights, but you also have responsibilities, right? So yeah, I hope this video did shed some light, and I hope you guys enjoyed it. Thank you, and I'll see you guys next time.